minutes. First off, though, let's talk about a worker at Gatwick who has thanked staff from Frimley Park for saving his life. Jeffrey Constable was at work, fairly normal day, and then he suffered a near-fatal heart attack. The father of 4 from Crawley was airlifted to Frimley Park Hospital, 50 miles away from Gatwick. Jeffrey returns to work this week for the first time, but he says that if it wasn't for his colleagues and staff at the hospital, he wouldn't be alive today. Well, joining me now is Dr. Vinod Achan, who is a consultant interventionist cardiologist at the Frimley Park Hospital, who performed the life-saving operation. Good morning.
Good morning.
So you performed the surgery. What kind of thing? Well, talk me through the actual operation. What actually happens?
So Mr. Constable had a cardiac arrest at his place of work in Gatwick Airport, and he was flown by an air ambulance to Frimley Park. At Frimley Park, we have a 24/7 heart attack service where we treat all the patients in Surrey and many patients from Hampshire and Berkshire, but also now patients from further afield who've had a heart attack. And what happens is that in this case, the air ambulance landed on top of the hospital. We have a helipad on top of our emergency department. The patient was immediately transferred to the operating theatre, where we performed the emergency angioplasty. So at the time, because he'd had a cardiac arrest, he was intubated and ventilated, and he had a full intensive care team looking after that side of things, and the heart attack team worked on fixing his heart.
And I understand you did this operation in 15 minutes. Is that quicker than normal?
No, that's fairly average. It's 15 minutes from the time of arrival. So what happens is that the heart attack team is alerted as soon as the ambulance crew identifies a heart attack patient in the community, and often the heart attack team are already in the hospital when the patient arrives, as was the case here. And the patient is then very quickly transferred to the operating theatre and the procedure performed as quickly as possible. So 15 minutes would be fairly average for a case like this.
Right, I've watched 24 Hours in A&E quite religiously, and they quite often, I think they've quoted that quite a high stat of number of people who actually have had a heart attack who come to hospital don't actually survive.
Well, so Mr. Constable's case was very different. He had a cardiac arrest, which carries a very high risk of death, and he had to be shocked out of his near-fatal cardiac abnormal heart rhythm that he had, and he then had to be put on a ventilator before he could be transferred by the helicopter. So in that situation, the mortality is extremely high. But the truth is that with this sort of treatment, and with the way in which it's being delivered at heart attack centres all over the country, the death rate from heart attacks is falling in the UK faster than in most other countries in the world.
How lucky is he to be alive?
Extremely lucky.
And the new helipad, which I know took a while to build, is quite impressive when a helicopter comes in on that. It lands on top of the emergency unit at Frimley. What kind of time difference has that made?
In his case, it's made a huge time difference because the journey by road would have taken probably an hour or more. So it makes a huge difference for this sort of case where transport times would otherwise be too long.
All right. Well, congratulations on another life saved. It must be,
thank you.
Well, fantastic for everyone there.
Yes, no, it's a huge. It's very satisfying for the whole team. There's a huge team involved. I'm just one part of it.
I'll be talking to you. It is.